Welcome people. In this video, let us look at the clinical manifestations of typhoid, paratyphoid. If a person comes to you, you will know what symptoms he is coming by. Then only you can say it is typhoid, right? So in the last video, we have seen the pathogenesis. Now let us look at the clinical manifestations. Typhoid, paratyphoid, both together they are under the group enteric fever. However, the manifestations are not just enteric. It's nothing to do only with the intestine or something. It affects a lot of other things. So look at this stepladder pattern of remittent fever. This is very important, okay? You should know stepladder pattern of remittent fever where you see in typhoid. So look at this diagram here. It shows you how that is stepladder pattern. Can you see how it is increasing here? Right? Stepladder pattern of remittent fever. Then rose spots. Can you see in this diagram the spots? Rose spots come in typhoid fever. Nausea, vomiting, anorexia. Anorexia is no appetite, doesn't feel like eating food. Nausea, vomiting, obviously because it is something to do with the GIT, right? Then there can be GIT bleeding, intestinal perforation. Perforations can happen. And it can also cause meningitis. Neurologic complications can be there. Okay, so even Salmonella typhi can cause meningitis. Okay, Salmonella typhi, Salmonella paratyphi, A, B, everything, A, B, C, everything can cause meningitis. Okay, so we are done with the clinical manifestations. Next, we have to move to a little bit of epidemiology we can look at. See, Salmonella typhi infection is more common than paratyphi infection, okay? And we have seen already some points like it comes through oral route, and especially risk factors are like people who have gastric acid less, like infants, people who are taking antacids because they have less acid, GIT surgery, or inflammatory bowel disease, right? We have already seen all this, correct, no? Inflammatory bowel disease, all this we have already seen. There are a lot of cases and all that depth you should go into. We are really not going into that type of depth. Coming to carriers, there are two types of carriers. We have fecal carriers and urinary carriers. Actually, fecal carriers are important, okay, because these are more common. The bacteria actually they multiply within gallbladder. They are excreted in the feces. Typhoid Mary is a very good example of a carrier. She infected, she was a cook and she infected more than 1,300 people, though she herself did not suffer the disease. Urinary carriers are rare. Here the bacteria multiply in the kidney and they are excreted in urine. Is there anything else that you want to know here in epidemiology? See, even this disease can even cause death. So we've just added the information here. It can cause meningitis, even death may occur. Okay. Let us just review everything that we have seen till now. Typhoid, Salmonella bacteria classification, antigenic variation we saw, pathogenesis we saw clinical manifestations, epidemiology, everything we saw, right? Clinical manifestations, epidemiology, pathogenesis we have seen, lab diagnosis we have to do, prevention, vaccination we still have to do. So here we saw that it is the genus Salmonella under the family Enterobacteriaceae. Antigenic classification, there is O antigen, H antigen and VI antigen. So we saw the classification, that is Kaufman-White classification. We saw the antigenic structure, the difference between the antigens, like what and all differences are there between the antigens. Then we saw the antigenic variation in each of them, O, H and VI. In O, under O we saw smooth to rough and lysogenic conversion because of the bacteriophage. Then we saw on the H antigen will completely vanish. in phenol, agar, or by mutation. In Craig's tube, you can show that there is phase variation. The H antigen from phase 1, it can become phase 2 if you put phase 1 antisera in the Craig's tube. Salmonella variation in VI antigen, we saw that it will become V2W. This is what is important actually, somehow that is missing. V2W variation. Then pathogenesis, we saw that it can cause enteric fever like typhoid, paratyphoid, septicemia, bacteremia, gastroenteritis. Then it is transmitted by oral route. Infective dose, you need at least thousands. Salmonella typhi risk factors are people who have less stomach acid like infants, antacid, people who have taken antacids, prior H. pylori infection, intestinal integrity if it's lost because of inflammatory bowel diseases, GIT surgery, antibiotics if the person is taking. Now, how does the salmonella enter or invade? They enter through cell membrane of epithelial cells. Okay, the cell membranes endocyte the bacteria. This is called as bacteria mediated endocytosis. The bacteria will remain in the vacuoles of the cytoplasm of the epithelial cells. The epithelial cells reach the submucosa. Here the macrophages come and they try to attack these epithelial cells. The macrophages phagocyte the bacteria. Now, but the salmonella which entered the macrophage, it even survives inside this macrophage. It survives within the macrophage. Then it will cause primary bacteremia. It will enter these organs, gallbladder, liver, lung, kidney. Then it will cause secondary bacteremia. It can cause meningitis. Even death can occur. Clinical manifestations: stepladder pattern, rose spots, nausea, vomiting, anorexia, GIT bleeding, intestinal perforations, neurologic complications can occur. Epidemiology, a little of epidemiology we are seeing. Salmonella typhi infection is more common. We have already covered the risk. Carriers can be fecal carriers or urinary carriers. And typhoid Mary is another important point that you can write in the exam. Let's move in the next video. Let us look at lab diagnosis. Okay.